Have you ever had blood work come back normal and still felt exhausted, foggy, heavy, and like something is just off? You're not imagining it. What Sergio Fernandez, a nurse practitioner and founder of Beacon Hormone and Wellness in Washington State, wrote about is the gap between what standard lab panel tests for and what they miss entirely. And what they miss, in a lot of cases, is the thing driving the problem in the first place. Welcome back to Health Over Wealth in the U.S., where we pull back the curtain on cash-based and client-centered healthcare so you can make informed decisions about your own health on your own terms. I'm Susie Rains, your host. Health Over Wealth in the U.S. is produced by the Centered Care Directory for educational purposes only, not medical or financial advice. Always consult a qualified healthcare professional for your specific situation. Sergio makes the case and backs it with data that insulin resistance is the single root cause behind many of the most common chronic diagnoses in America today. We're talking about obesity, high blood pressure, high cholesterol, type 2 diabetes, and hormone imbalances. Not separate problems in many cases, one problem with many names. Here's how he explains it. Insulin is the hormone that tells your cells to absorb glucose for energy. When your cells stop responding to that signal because of diet, stress, poor sleep, inactivity, your body compensates by producing more and more insulin. Eventually, that compensation breaks down, and what follows is a cascade: weight gain, blood sugar issues, hormonal disruption, and inflammation. The part that struck me most, he says this is largely reversible, not managed, reversed. What does standard medicine miss? This is where Sergio's perspective as a functional medicine practitioner really comes through. A standard metabolic panel gives you a fasting glucose and an A1C. That's a 3-month glucose average. That's what the A1C covers. Those are useful, but they don't show you how hard your body's working to manage blood sugar before it becomes a diagnosable problem. What Sergio orders is a fasting insulin level alongside fasting glucose. Together, those two numbers tell a much more complete story. He also talks about the coronary calcium score, a test that gives a clearer picture of actual cardiovascular risks before defaulting to a statin, a full hormone panel, because insulin resistance directly affects testosterone, estrogen, cortisol, and thyroid function. These tests are not exotic. They're not expensive. They're just rarely ordered in a 10-minute appointment because there isn't time and the billing structure doesn't support it. That's the system's problem, not the practitioner problem. And this is exactly why practitioners like Sergio operate outside of it. Sergio included some statistics in his article that I want to share because they put the scale of this in perspective. 1 in 3 American adults has prediabetes or insulin resistance. I'm going to put myself in there because I know I have insulin resistance, so I can relate to this very much. That's 115 million people, according to the CDC. 40 million adults in the U.S. have type 2 diabetes, and 11 million of them don't know it yet. 3 in 4 American adults have at least one chronic condition, and more than half have 2 or more. And here's the one that really landed for me. The estimated cost of chronic disease worldwide is expected to reach, I'm going to say this clearly, $47 trillion with a T dollars by 2030. Let's sit with that for a minute. The estimated cost of chronic disease worldwide is expected to reach $47 trillion by 2030. It's only 3.5 years away at the time of this recording. Sergio's point, and I think it's the right one, is that most of these diseases are preventable, not just manageable, preventable. The NIH and the American College of Lifestyle Medicine put that number at 80%. 80% preventable. I want to share something Sergio wrote at the end of his article, and you can click on his article in the show notes. He said his goal is to help people lead healthier lives, reduce their dependence on medications over time, and feel their best for as long as they need support. He named his practice Beacon for exactly that reason, to be a guide, a light for people who are tired of being in the dark about their own health. If you're in Washington State and you want to work with Sergio directly, you can find Beacon Hormone and Wellness at beaconhormone.com. You can also search for him in the Centered Care Directory at how.healthcare. If you're outside of Washington and this conversation sparked something for you, if you've been told your labs are normal while still feeling like something is off, I want you to know that functional medicine practitioners who work this way exist in your area too. You can search by specialty and location at how.healthcare. Every practitioner listed has been reviewed and approved. The search is free. If you want to read Sergio's full article with the specific test to ask for, the frequently asked questions section, and all of the data, it's live now on the Health Over Wealth in the US at how.healthcare.